So, Giampolo, you are now, well, actually you have been president of the Italian affiliate for several years now?
Yes, it's been going on for 3 years now.
For 3 years. So you were the president during our last Congress in Rome.
Yes, and I was in charge of the local organizing committee together with Massimo Manetti, so quite a hard work in the last years.
Right. And now with the perspective of being almost 2 years after, can you think of any impact that conference had on the local Italian infant mental health professionals?
I think it actually had a huge impact because it was the first time we were hosting an international World Congress in infant mental health, so it was a big task for us. We've been working hard for nearly 3 years to get ready for that, and one of our main goals was to support the Italian movement of infant mental health and to make it grow out of this great opportunity, which actually turned out this way as we expected. So it had a big impact, and people in Italy are more and more aware of infant mental health aspects, and professionals are more involved in the Italian association and in WAIMH as well.
Did it have any impact on the policy, on the Italian policy for infants and parents?
I think it is starting to have some impact, because especially we had a focus in the WAIMH Rome Congress on refugees, as you may remember, with Kai von Klitzing, with the presidential symposium on these. So we started to have some good feedbacks from the Italian government with this respect. So we are planning to do some research and some intervention on this.
Good. Can you think of any topic that would not really be, I mean, the awareness of the average clinician was not so big, and after the conference it became kind of a, wow, we have to think about this topic regarding our daily...
That's an interesting question, because, for instance, sometimes I think that plenary sessions and plenary speakers can have a big impact. I remember Jenny Radesky's one on the use of digital devices in little ones, and it really impacted a lot, and many people was really all of a sudden aware that there is something to do there, there is research to be undergone, and so this is an example of how it had a huge impact on professionals, of infant mental health professionals, with new topics.
Yeah, that's and also, of course, the new connections, and sometimes there are even multi-center studies that start with an encounter at the Congress.
You're right. It's always a great chance to be at the World Congress, especially WAIMH World Congress, because you can start knowing each other, and all of a sudden maybe you understand that there is a partnership that is there at hand, and that you can go ahead with the research program.
Level, I know that you work a lot about the development of morality, and did the conference, did any symposium or plenary make you think differently, or had some impact on your...
There were so many that it's just difficult to say, but I want to say that I had the great pleasure of organizing a symposium with Bob MD on early moral development, and that was one of the highlights of my professional and academic career, so it was a great chance for me, and something that is really stuck in my wonderful memories.
Yeah, this WAIMH thing, I think, is a mix of really good scientific thinking and with a lot of warmth and friendship that starts between the members, and then And I think that it is really felt during these meetings that we are now looking at abstracts and reading abstracts and again and more, and still we have this kind of very warm atmosphere.
This is the WAIMH flavor.
Yeah, I agree. I totally agree.